The number of COVID-19 cases has breached the 12,000 mark, but over the weekend, people have been going malling to savor their temporary freedom from quarantine. People now risk being infected if they do not observe health precautions. What are the next steps in a modified quarantine? We discuss in this episode of the Chiefs. And welcome to this special episode of the Chiefs. And with me, of course, as usual, are Ami Pamintuan of the Philippine Star, Lucio Cruz Valdez, head of News 5, and Robbie Alampay of One News. Ladies and gentlemen, here we are again. Happy weekend. Naunahan ako dun.
Under an MECQ.
Yeah. I'd rather put it this way. 13 araw na lamang.
Nagsipunta ba kayo sa mall?
So far.
Ikaw? Nagpunta ka na?
I'm taking 13 araw na lang. So far. Hindi natin alam kung biglang magbabago. Especially sa nakita natin over the weekend.
Grabe.
Teka muna.
This morning, di ba? Sa Kainta, yung mga motorsiklo, talagang they were taking up the whole road. The whole road. Grabe.
May traffic na, marami na. Pero banda rin sa bandang Rojas Boulevard, hindi pa, maluwag pa rin. Maluwag pa rin siya.
Talaga, sa Manila?
There are two things, di ba? Dumami talaga yung mga tao, especially people who have been eager to get back to work. That's one. But also, a lot of pictures that we're seeing are also at choke points. Kasi dumami rin talaga yung mga, meron din talaga crucial and critical na checkpoint. So, may choke points talaga eh.
Yes. Tapos ang daming pumapasok na walang ID, na hindi alam kung anong mandatory, kung anong hindi. Alam mo yon, medyo magulo eh. Medyo magulo.
Yeah, there is some confusion naman talaga. Kasi for example, earlier they were saying na you can go out and exercise, go jogging, so long as you practice social distancing and you wear a mask. Pero apparently you can't do that then kasi you need to have a quarantine pass. You can't just go jogging. Hahanapan ka ng pass. So, may confusion. Ano ba talaga?
Baka naman nagja-jogging sa mall.
Yeah. And speaking of mall, di ba? Siyempre, iba yung mga umaalis ngayon para sa trabaho, di ba? But yung nagdagsaan sa mall, ang isang malinaw talaga doon is a lot of people took the messaging to mean na lifted na. When in the meantime, government was trying to assert, actually walang magbabago as far as di ba? ECQ, MCQ, you are still required to stay at home. Di ba?
Yes. At saka yung mga bukas naman na outlets, hindi naman mga department stores eh. Groceries din, saka food chains.
Konti lang actually nadagdag eh. Pero siguro people were curious eh kung ano nangyari dun sa mall. Kaya nagdagsaan lahat. Tinignan na sila eh, di ba?
Pero marami rin nagpapalamig. I mean, and that's not to be excited about it. Diba? There are really people who want to
Kinigil nila ang thermostat. Diba?
Pero pinainit may dala ng
26. 26, that's still hot.
No, but that's still better than the 30 plus.
That's true. No, but when there's a crowd, that's hot. That's hot. Diba?
But I guess we're all hoping na unang bugso lamang to kasi mga tao gigil lumabas eh. I mean, 2 months of a lockdown, suddenly you apparently are free and labas sa mga tao. Hopefully in the next few days, people will realize na teka, we have to pull back a bit. And hopefully that's the way things develop in the next few days. Anyway, so let's bring in our guest siguro. Our guest tonight is IATF Special Advisor Dr. Anthony Leachon. Actually, he's one of our regular guests, even before the COVID-19 story broke out. Let's bring him in, si Dr. Leachon. Hi, sir.
Hi, sir.
Hi, good evening, and thank you for joining us po.
Ed, Roy, Robbie,
sir.
Hi.
Yes, sir. You were quoted as saying that we apparently lost the gains of the last 2 months of our quarantine with what happened over the weekend. Pero may ibang sinasabi ibang tao. There were some people who were saying naman, for example, si DTI Sec Lopez was saying na mukhang hindi naman ganun ka-crowded sa malls. Kayo po, after reviewing everything that's been coming in the past 24 hours, how do you assess how, well, for example, NCR has reacted to the MECQ?
Well, siguro na-quote ako, Ed, doon sa aking Facebook account at saka sa Twitter as of course, that's my personal opinion. I don't speak for the IATF. You know that the spokesperson is Secretary Harry Roque. And
Roque.
yeah, and when I saw the pictures on social media, I immediately texted Secretary Ed Anyo, who's the DILG Secretary and the Vice Chair of the IATF. I regularly provide feedbacks to Secretary Galvez, Secretary Lorenzana, who's the National Action Plan head, and Secretary Ed Anyo. And right there and then, he said to me that if tomorrow, that's because I reported that I think Saturday evening, if the malls will not behave, I will order the malls closed and fine them, or if they violated the Bayanihan Act. And that was the message I got from Secretary Ed Anyo. And the next morning, I think General LSR went to the malls and then talked with the mall managers. And some, of course, officers of certain malls talked to me regarding that. But I think Secretary Ed Anyo issued a strong statement on that. And I don't know the results right now regarding the rounds of the malls, but basically the government will clamp down any violation of the IATF guidelines. So so basically that's it. That's what I said, and my job is to report what I usually see in social media, and perhaps that's the reason why I was quoted. And I was only given the blessings last Sunday by my boss, Secretary Galvez. Actually, I report to Secretary Galvez. I'm the National Task Force Advisor. We were not given the liberality and to speak because kailangan daw unified yung message. So all the messages were coming from the palace. But since we told the secretary that perhaps because of the new guidelines, you need a lot of communications, and there are medical reasons behind certain guidelines, and there are stories behind the headlines, and perhaps we need to step up in terms of communicating to the public. Like today, I had about 6 interviews, not basically on the guidelines, but basically on medical aspects like second wave, a lot of things related to contact tracings, not really because of the guidelines or the violation, but the far-reaching implications medically.
Yes, sir. But Doc, I suppose kasi there is also a lot of confusion dun sa messaging ng gobyerno mismo. An example lang is what we were talking about earlier, just before we brought you in. There were officials being quoted na pwede nang mag-jogging yung mga tao basta lang naka-social distancing tsaka naka-face mask. And apparently, hindi pala kasi you still need a quarantine pass. You can't just go out jogging. But there was confusion dun pa lang sa messaging na yun. So a lot of people went out thinking na so long as may distancing at may face mask and you follow all the sanitation hygiene protocols, and then everything is well and good. So may ganun din pong element doon na nagka-confusion doon sa ano ba talaga itong MECQ.
Ed, alam mo, being there every day, I work from 9 o'clock to 5 o'clock and sometimes longer than that. For someone who's there, my only suggestions perhaps before the release or cascade of the guidelines, baka dapat the main key factors na prime or na shape yung minds of the citizens. For example, the guidelines lang naman na dapat i-discuss on last Monday was basically on the geographical areas. But perhaps before the meetings, it should be gradual, it should be phasing, it should be incremental, it should be localized and zoning. Baka dapat na-explain siya before na nilatag yon, plus the other processes related to it. Yun lang ang tingin ko.
Doc, kanina nga po pinag-uusapan namin, maybe even before the guidelines, there's a very basic question or the very basic, guidance to people. basic question. Under MECQ, ang mensahe pa rin sa tao is stay home, di ba?
Yes. Actually, Robbie, yung modified ECQ tsaka yung modified GCQ, wala siya sa WHO guidelines. Ginawa lang yan ng NTF para may dry run ka for the GCQ. So basically, it's ECQ for the critical zone, for the containment zone na yung containment zone, ang ibig sabihin yan, 1 to 19 cases per 100,000 population. Yung critical zone red spots, when you see that on the map, that's about 20 cases per 100,000 population. Then yung yellow, we call that the GCQ, and then which is the buffer zone. Ang definition niya, no cases for the last month. And then yung green on the map, pagka granular na yon using the satellite map, yan yung outside of the buffer zone. Yun yung tinatawag na new normal. So basically, tama po kayo. Pag sinabi po nating MECQ, basically po, your app virtually is an ECQ. Ang nagbabago lang po dyan, yung essential workforce mo ay dagdagan ng 50% ng workforce mo. Yun
Because
po yun.
would you agree that would you agree? Just as observers, we're all observers here. Would you agree that if you look at how people behaved and acted over the weekend, the message that they got and that they were acting on did not seem to be that. In fact, they seem to be behaving on a messaging that they're perceiving na may nagbago dito. And in fact, pwede na tayong lumabas.
Ang comment ko, I was thinking about it also, Robbie. Pero there are 3 reasons why we usually fail. Yung unang-una is ignorance or lack of knowledge on that. The second is pasaway or ineptitude. Pero ako naman, during the lockdown sana 60 days, I hope na yung mga malls and the private sector prepare the mall na parang pagpasok mo doon, meron ka ng social distancing measures. What I'm trying to say, di ba pag may lockdown, it's just buying time to increase your health system capacity, yung testing, yung mga swab centers. I thought all along, in parallel, the malls and the private sector prepare the processes. For example, yung footprints blocks, because in Baguio and other model cities, nagawa yon. Pag punta mo ng mall, isang entry lang, isa rin ang exit mo, and you have distancing.
Pero meron yun, Doc.
Walang ganong klase na nakita ko. Nung kinol lang attention, saka lang nila inayos yun. So all along, for the last 60 days, walang ganong klaseng preparation. Yun lang ang napansin ko. And when people like that, na nakita mo na foot traffic, iba kasi yung may checkpoints You can walk to the mall, and then kung walang restrictions o obstruction doon, may problema somewhere Yun ang aking analysis as a person going to the mall. I usually go to the mall every day because I go to fitness first every day, 7 to 9
Yeah.
And nakita ko, walang ganong klaseng shaping up of the environment yung sa private sector side.
Yeah, pero sundutin ko lang na mabilis, Doc, because you said ignorance, pasaway, preparation on the private sector. But going back, shouldn't the messaging of government be a factor here? Because all 3 blames the people. It blames lack of discipline supposedly on the side of the people. It blames the private sector for lack of preparation. Where is government's responsibility to have communicated this well in the first place?
Yeah, ang tawag doon, Robbie, ang tawag dyan risk strategic communications But yun ang problema if you have less communicators, that's a problem. Because you cannot really explain everything Kaya dapat yung bits and pieces, nahihimay mo siya. So I don't have any answers, Robbie, to start with. Kaya I usually go to the social media lang to articulate lang yung findings ko. And that's my personal opinion outside of being an NTF advisor. I'm also a citizen trying to, fix things kung may magagawa tayo. I'm a small voice. And your comments are basically valid, and that's true. I just want to be transparent and straightforward as well. My role right now is to add value to what you're doing and perhaps relay that to the decision makers tomorrow.
Doctor,
And
you're a
right now
Doctor, you're a public health advisor, so and you mentioned the second wave. In fact, yun ang warning kanina ng Malacanang, si Presidential Spokesman Harry Roque, sabi niya, dadami daw yung COVID-19 cases because of the behavior we saw over the weekend at the shopping malls. How valid is this fear na nakita naman natin yung crowds na yun, napakarami talaga. How valid is that fear na magkakaroon nga tayo ng second wave, or is there even na tapos na ba yung first wave, tapos na ba tayo? No? Can we talk about the second wave already?
Actually, that's the second wave. The fact na nag-lockdown tayo, yung accelerated phase during the first month, nung nag-GCQ tayo ng March 14 and March 16. Even if we don't see the curve, well, I saw the curve last May 12 by Dr. Wong, and we're basically at the peak and then plateauing. So, ibig sabihin, nag-accelerated na tayo. But given na yun na pagka nag-movement, even in the first world countries like Japan, di ba, ang Hokkaido na nagbukas sila. South Korea, there's a super spreader of a young man and went to the bars. And then also Singapore, and then Hong Kong, and then Taiwan. These are first world countries. For a country like us na wanting, let's say, undisciplined natin, expected yun. Plus unique ang country natin because the typhoon, which will actually bring dengue fever and flu and all these things. Ako, ina-expect ko na meron tayong multiple small amplitude outbreaks in the next 2 years prior to the coming of the vaccine. So, sa akin, even without the malling thing, basta't gumalaw ang tao, mag-i-increase ang cases niyan. And then ready naman kami because of the granularity. Basta nag-increase ng 20 cases sila per barangay or per municipality based on the zone, we're going to clamp down. Yun ang order naman. Those are the marching orders. So my answer, the long and short of it, the answer is that we expect outbreaks even without the mall opening.
So kung outbreaks, ang sagot ba din, yung lockdown, yung specific barangay-based lockdown, community-based lockdown, tama ba yung
Yeah. Yes. Meron na kasing satellite map ang DILG, and you will see 4 colors, red, orange, and then yellow and green. The red will stand for the critical zone, that's the hot spot. Definitely. And then yung NDCQ. And then when you're orange, you're modified NDCQ. And then if you're yellow, buffer zone, but you're contiguous or katabi mo yung critical zone at containment zone, ibig sabihin okay ka. And then the green, malayo-layo ka, parang new normal ka. So ang binabantayan yon. Oras na yung orange and then ang yellow, nagbago yan, you have to clamp. The LGU has because of the local government code, pwede niya i-clamp down. Like Governor Rimulya in Cavite, nakita niya the lack of preparedness of the mall operators, ina-lockdown kaagad niya kasi ayaw niya kaagad ng outbreak. So yun yung mga example sa sinasabi natin dito.
Doc, kamusta yung testing? Are we ramping up? Since you're saying that we fully expect na dadami nga ang cases because of the modified ECQ.
Unfortunately, based on the tracker of the DOH, ang expected kasi natin by May 15, it will be 15,000, and by May 30, it should be 30,000 tests. And then dapat maka 1 million tests tayo to say na it's significant. As of today, parang naka 10,000 lang tayong tests. So we're far off the target natin. And that's in the tracker. I'm just here to narrate it and relay it to you. So hindi pa ho tayo namimit ho yung target natin ho sa testings. And according to Secretary Roque this afternoon, I sinasabi the government may not have the capacity, and he's deferring it to the private sector to help out in terms of the testings, particularly the employees. I think I read that.
Yun na, sir, hindi namin
Pero sir, is that would that be a prudent thing to do to leave it to the private sector to do most of the mass testing? Shouldn't it be government that takes charge here?
It should be the government, but my wife works at a multinational company, and of course the leadership would sponsor yung testing nila. So at least a big help yan. I think Secretary Joey Concepcion together with the business community are doing their share right now. But I agree with you. There are certain yung mga LGUs should actually shoulder, particularly yung 40% of the population na below poverty line. And I think the government should shoulder it. Hindi ko lang alam yung budget that would correspond to that particular line of thinking.
Yes.
Yeah.
Doc, going to that line of thinking, could we just clarify, because you said the government doesn't have the resources. Is it a matter of resources or is it a matter of plan of attack? Because there are countries who are still debating whether or not it's efficient or even safe to do mass testing as a principal strategy. So when the
That's very
government
good.
says, no, we are leaving it to private sector, is that strategy or is it just a function of actually wala kaming capacity?
Iba't iba, Robbie. Maganda yung tanong mo. Let me answer that in variable ways. Kanina napansin mo, sabi ni Secretary Bello na for the return to work, hindi mo kailangan mag-testing. And then I saw a DOH guideline given by my wife that in asymptomatic cases, hindi ka na kailangan mag-testing.
Yes.
Magmamask ka lang and do all these hygienic measures. So meron doon, I think mga medical societies nag-support. That's one side. While naman sa Wuhan, 11 million sila dahil mapera sila.
In 10 days.
Sinagot lahat ng China. I don't know if the strategy would suit, let's say, budgetary capacity. Let's say sa South Korea, sagot din ng gobyerno yun. 400 to 500,000 tests na sila. Sa Vietnam, wala silang pera. They're richer by more than 10 times sa atin. By the allocated budget, they have 600 sites and they have zero deaths. Zero deaths. Yeah. So I don't know. But I'm saying maybe the messaging may be secondary to the medical societies not advocating a test for the employees. I don't know kung ano sasabihin. But ako tatanungin mo, I did already swab and rapid antibody test. Ako papasok ako sa hospital, pinapapasok na kami, June 1 pa ako. I'm not emotionally prepared, I'm not physically prepared kahit naka 2 months na ako. Because I want to be sure na okay ako, may antibody ba ako, wala. Kung wala akong antibody or wala akong IgM, IgG, I have to protect myself because I'm going to the hospital. And anytime na magkaroon ako ng problema, may halo effect yan sa family ko. So I should be responsible for myself, for my family. So kung yan ang decision based on science, ako as a physician, I would be more careful with saying that kung I have only 700 pesos, I would spare that for a test, whatever it is. Like for example, pagpupunta ka sa Malacanang, April 20 when I was as a key opinion leader, I had a 15-minute test and rapid antibody, and all the cabinet secretaries who would enter the palace would use that. So if that is good for a cabinet member or for a key opinion leader, why would that be good for someone? The LGUs nga, kung hindi nyo po pa alam, the return overseas workers and the OFW and the locally stranded individuals, we call it LSI, ayaw pumayag ng mga gobernador at mayor na hindi RT-PCR ang test sila pag hinatid sila from one point to the final destination nila because they don't want an outbreak. So, kanya-kanya po The guidelines are there, but the guidelines are meant to be broken depending who sa LGU leaders.
Yeah, but I asked Doctor because I asked because if it's not a
beautiful question, actually, Robbie.
Yeah, but if it's not a strategic decision and ultimately it redounds to wala kasing capacity, kulang kasi ang resources, then it begs the question, then what's the emergency fund for? Asan yung billion na itinabi natin supposedly to respond to this? We would have thought that there was a component there for testing.
Robbie, I did not say, Robbie, let me correct that. I did not say walang budget.
I'm not saying that you said it.
I'm trying to lean on, as a physician, I'm trying to connect the dots kung bakit ganon. You have Secretary Bello saying hindi kailangan, then nakita ko yung guidelines, and then meron man valid reasons. Pero when you see other countries, because of their budgetary capacity na pwede nilang gawin, magastos sila for the test. Like China, Ang China nga pala, 6 cases last 3 days. So ibig sabihin, even in China, even with draconian measures, nagsalita yung kanilang number 1 expert na a second wave is looming as well. No? So even in the best countries na na-crash nila, meron pa rin posibilidad. So it's possible for us na hindi ganon kalaki ang ating discipline. I don't know about the budget, but it is expected na baka tayo magkaroon ng second wave because we're unique to other countries because we're visited by typhoon more than the other countries.
Itatanong ko nga sana yan, Doc, yung sa typhoon na yan because we saw what happened with Typhoon Ambo, ano? Nagsabi yung mga governors in the affected areas, it was a nightmare, it was impossible for them to maintain physical distancing. Is this a big problem? Papalapit pa lang tayo sa typhoon season. And yung mga evacuation centers are actually being used as quarantine centers at this point. Malaking problema ba yan for a potential resurgence or spread of the coronavirus?
Hindi lang yun, depleted na raw ang funds.
Yeah.
I mean, na-flag ko yan during our meetings because pagka nagmi-meeting kami sa Camp Aguinaldo, nandun din yung Office of Civil Defense, nandun yung NDRRMC. In fact, kung kami nagmi-meeting twice a week, na-flag na yan na pagka nag-typhoon, they will be going to evacuation centers, not on the isolation and quarantine areas kasi clean up yun eh. We don't want to, create problems there. So pupunta doon, but they will maintain social distancing doon sa mga evacuation centers na lang, just in case ma-apekto sila ng floods. So this is the game plan na anticipate na nila yan na baka magkaroon ng problema and that will negate yung social distancing. So the quarantine areas na binild, hindi yan gagamitin for the evacuation. Separate sila, perhaps sa school or sa mga dati pang ginagagamitan. But definitely not the newly built and refurbished na mga centers na ginawa ni Secretary Vince Dizon.
Pero hindi yun yung nangyari sa Eastern Summer eh. In fact, that was what Ben Ebardone was telling us. The governor, sabi niya, they were forced to use the quarantine center as an evacuation center. Tapos mag-uumpisa pa yung school at the height of the typhoon season, August 24. Matagal na nagrereklamo yung ang DepEd na bakit daw ginagamit yung mga schools as evacuation centers. So sunod-sunod na yan. Paano yun? Anong solusyon kaya?
Well, weekly meron kaming meeting sa mga provincial governors. Ang head niyan ay yung head ng ULAP si Quirino Province, Dakila Kuwa. Na i-flag na namin yan. So sabi namin dito, pagalingan to. Meron kaming template na kung ano yung gagawin. Ang problema lang yung speed and then the leadership style. Alam mo, iba't iba. We went to Caraga, masyadong prepared sila na wala pa dun yung masyado yung epidemic. We went to Zamboanga, nagkaroon sila ng cases because of the jail. But wala pa rin, 3 ang center sila. Ang Davao, ready. And then Cebu, nanggaling doon si Secretary Dizon, nagkaroon na ng epicenter again because of the clustering din sa jail and 1 sitio sa Patera. This week we'll be going to Baguio because there are also some areas there and in northern Luzon. So, ang masasabi ko, Ami, it's dependent on the leadership and meron naman silang template on what to do. That during this time, dapat meron na silang isolation and quarantine areas and then may separate na sila dapat na evacuation centers because they know si Governor Ibardone nadadaanan ng late summer lagi. Na-flag na yan 2 months ago, Ami.
Doc, last na
Doc,
lang.
before,
no? Do we have enough number of beds sakaling magka-second wave? Huwag naman sana. Pero ano dapat yung rate ng transmission or infection para matugunan yun kung sakali? Do we
have enough
number of beds? Isolation beds.
Yung isolation
Okay.
beds natin.
Yes.
Meron ako yung data, if I may.
Yes.
We are ready.
Kasi yun ang worry ng lahat eh. Paano pag nagka-second wave? Saan mo ilalagay yung mga yun? Lalo na we're seeing people crowding all over.
We have, merong safety zone merong warning zone at may danger zone. Only for, wala tayo pang problema sa isolation beds. At
So we have enough.
ang tawag dyan, critical utilization rate, and define as ventilator, ICU, and isolation beds.
Okay.
Wala tayong problema pa so far. Hindi pa tayo nando sa ceiling ng warning and the danger zone. We're okay.
Okay.
We're okay
Okay.
there. Malaki
Yeah.
ang ating
Okay.
may headroom tayo doon.
All right. Good
Well,
to know.
Doc, before we let you go, let me just squeeze in one more question. Sorry po kasi we've been talking about messaging dun sa MECQ and yung compliance dun sa MECQ. Now, well, some government critics, and I've seen quite a number of them in social media, have been asking what kind of messaging is government delivering to the public as far as the MECQ is concerned. If the president himself, on the first day of the MECQ, flies off to Davao ostensibly because he wants to see the situation there himself, but also because he wants to visit his family, di ba? What messaging daw does that carry across to the public?
Well, ano yan eh. I think that's a shared responsibility. I cannot speak for the president, but I think dapat meron tayong shared responsibility and you know how to protect yourself. I don't know. I don't have any answer. But ang sagot ko lang lagi dyan sa aking mga Facebook Live, pag kahit tayo government official o maliit tayong tao, when we go out of the streets, we need to protect ourselves so that we can protect others as well. And sa mga decision na gagawin natin, sa ngayon, the virus will dictate our destiny and our paths eh. And we need to, you know, protect ourselves na lang. I go out every day. I don't know what will happen to me, but I protect myself. I do some tests para malaman ko kung okay ako. And so far, I take risks, but I'm still okay. I think I would have added value dun sa mga ginagawa ko. Ed, I don't have any answer dun sa mga decisions na gano'n.
Opo.
Oo nga. Yeah.
Well, Dr. Anthony Leachon, IATF Special Advisor. Sir, Doc, thank you very much for joining us tonight.
Oo, sobrang hirap kayong kausapin. Masyado kayong magagaling. Sobrang kayong magagaling.
Si Robby, may kasalanan si Robby.
Kasi every time na class ako, kinakabahan ako sa inyo. I need to read a lot. Kasi ang gagaling nyo lagi.
Okay.
Ito kasi mga may edad eh. Oh.
Oy.
Okay.
Nang basag ang
Tingnan sa
kwet.
Ang gagaling nyo.
Okay, Doc, maraming salamat po.
Troll kasi to, troll kasi to, troll.
Ako honest lang ako sa sagot ko lagi.
Yes, Doc, we know.
I'm trying to be very honest with you. Wala naman ako itatago sa inyo.
And that's why we love having you on the show.
Maraming
Maraming salamat po, Doc.
Maraming salamat pa.
Thank you.
Thank you, Doc.
Kasalanan
So,
ko
stay
yan,
right there. Ito yun.
Nabawasan na naman kayo ng isang guest na hindi na mabalik.
Wait, teka, gap muna tayo. Nag-intay yung susunod nating guest. Okay. We'll be right back, so please stay with us.
Sino ba?
Hello po. Si Dr. Robby po ang mag-i-intro.
Welcome back, the Chiefs. We're now in the final stage of our conversation for this episode. Joining us is an advocate for sustainable mobility, Mr. Robbie Siy. Mr. Siy, welcome po to the Chiefs.
Hi, Robbie. Nice to be here. Thank you.
Well, thank you. It's a pleasure to have you, sir. Mr. Siy is a graduate of Ateneo de Manila's Management Engineering program. He has a PhD in City and Regional Planning at Cornell University. Mr. Siy, you know, one of my favorite urban planning and mobility advocates also, Benjamin de la Peña, keeps posting on Facebook. He's a good friend of mine. And he says, you know, crisis equals opportunity. And he says, in this crisis, there's a lot of opportunity to prove some points about mobility. Do you agree?
Absolutely. In fact, I was just talking to Benji today, and we had very good conversation on exactly this point. If there's one thing that could come out of this crisis, is one thing is that we could come out with a better transportation system, and that's something that we sorely need. So I think what I'd like to talk about maybe as we go through this show is to talk a little bit about the impending crisis, but also the chance we have to craft and evolve a much better public transport system.
Yeah. Mr. Siy, when you look at the pictures, never mind the traffic, no, never mind the dismaying pictures of the last 3 days, but when you look at an empty EDSA, when you look at the blank canvas of Metro Manila without the traffic and so on, what comes to mind to you as things that we can do to come to not just a new normal, but a better normal?
Well, for me, it's really about making best use of available road space. You know, today and pre-COVID, we've always prioritized cars on our roads. But you know, the reality is that car owners and car users represent only a very small minority in the population. For example, in Metro Manila, it's only about 12% of households who have access to a private car. So really, we must think of using our available road space for public transport, walking, and cycling. And this is really where all other countries are going and where we need to go as well. If we want a more livable city, if we want a better future for our children, that's the number one prescription.
Mr. Siy, you want to develop the bus transport service to make it more efficient. You want to develop bus stops, a new system of paying the drivers. This is not the first time that these proposals have been made. How feasible is it at this time? What makes it different this time? You think it's more feasible? You know, you're saying that you should never waste a crisis. Now, why is it more feasible, do you think, during this pandemic?
You know, Ami, let me put it in context. And I'd like to answer your question by first laying out what we will face once ECQ is lifted, and also as we go through into MECQ and GCQ. What we're facing really is a crisis in public transport because of the physical distancing. We have lost already more than half of our public transport capacity. That is a staggering number. And to think of, you know, pre-COVID, we already had huge crowds and huge queues of people, you know, lining up, waiting for hours to get to public transport. It's going to be a lot worse. And let me explain why. You know, let's look at MRT3 as an example. Pre-COVID, MRT3 carried about 350,000 passengers per day. DOTR has already announced that with physical distancing, MRT3 will probably carry no more than about 50,000 passengers per day. That's a loss of 300,000 spaces on our trains. And we've heard, I think we've seen announcements that MRT3 may actually have queues that are 3 hours long.
Okay.
I think that is a
Yeah.
very difficult situation, but
Yes.
that's only part of the environment that we will be facing. The other part of it is that many of our public transport operators have an uncertain future if they are to rely mainly on fare box revenues. You know, we have a unique situation in the Philippines where almost all our road-based public transport requires the public transport operator to be financially self-reliant. In other countries, you know, London, Singapore, New York, you have the government actually managing a public transport service and controlling that service. Here, we are in a very tough situation because all of a sudden, our public transport operators will only have 50% or less of their seating capacity. This renders a big chunk of them automatically financially unviable. And we stand in the next few months that many of them, and I would say perhaps 50% or more, will go out of business. So our first wave that we've already been hit with in the public transport sector is that physical distancing has reduced our capacity. We stand to lose yet, a further major cut as public transport operators get out of business or shut down. So if you can imagine, this is like a ticking time bomb. This is the alarm that I want to sound at this stage. And I hope our legislators are listening. I hope our policymakers are listening.
So how can the government compensate for whatever we will be lacking in terms of public transport?
So Luci, that's a very good question. And what I would prescribe is this. First, we must assure that public transport operators will be out there serving the public. So for major routes, and especially for Metro Manila, what I would advocate is that government goes into what we call leasing or service contracting or chartering, meaning that they would assemble public transport operators, ask them to form consortia, and then give them contracts to provide the service. This is how public transport is organized in the highest quality cities. London, Singapore, they have this model where public transport operators are on performance-based contracts. So this enables the government to set service standards and then monitor performance of operators and impose penalties on the contract in case there is non-compliance. So this is how the transport industry is motivated to deliver better service. So that's number one. Second is we need to overcome the big cut in public transport capacity by making our public transport services more efficient. So we need to improve the efficiency of our buses, our UV Express, our jeepneys. And how do we do this? So one very good strategy is to put public transport on dedicated lanes. Today, our public transport loses its capacity because they are stuck in traffic. When a bus is stuck in traffic, it has fewer round trips. It can move fewer passengers. So, for example, in EDSA, a bus on EDSA used to have about 7 round trips in a day, about 10 years ago. Today, it's probably down to about 3 round trips in a day. And there's also a big threat in the horizon, which is COVID-19 is pressuring people to use private motor vehicles. So there is now a lot
Yes.
of apprehension about using public transport. So
Yes.
whoever has a car or a motorcycle
Right.
is now, incentivized to use
Yes.
that vehicle every day. So if
Yeah.
we thought traffic was bad, 3 months ago,
Before.
expect something even worse. And this is what
Right.
we are seeing in many cities in China today that are now coming out of the lockdowns. So
So
those are
how
the
do
two
you
things. Yep.
how do you shatter that mindset for private vehicle owners like me? No,
Yes.
how will you convince me to take public transport?
Well, first, I think you must be convinced that public transport will get you to your destination faster. Second is you need to be confident in the hygiene of the vehicle. So this is another aspect that we need to consider. If you have doubts about the ability of the public transport operator to spend for disinfection, which is now required, if someone's not making any money, how can they afford the chemicals that will be needed to disinfect the bus or the
Yeah.
jeepney? We need to provide these operators with the resources. We need to actually monitor the disinfection process. So this is where the regulators have to concentrate. So if
Yeah.
we put the operator on a service contract, we will be providing that operator with sufficient financial uh, resources in order to undertake any necessary disinfection.
Mr. C,
Yes. Yeah.
to prove the point, at least for the next few months, to prove the point about the viability and the wisdom of service contracting,
Yep.
I asked the same question of Benji. Have you done the math on it? I mean, how much would it? How
Yes.
much is the investment on government's part, at least for the next 3 months, to prove the point about service contracting?
See, I would say we need to think of it really as a solution for Metro Manila because Metro Manila has a very complex public transport system. And if we look at the needs in Metro Manila, our estimate is that it would take about 5 billion pesos every month in order to hire about uh, 3 to 4 thousand buses and maybe between 10 to 20,000 other public transport
Jeepneys.
vehicles
Yeah,
like
yeah.
jeepneys or UV Express. So over a 4 to 6 month period, I'd say we need to invest about 30 billion in order to carry us through. But
Yeah,
in my view, we have no choice. This is
yeah.
something that we need in order to keep our public transport services running, because otherwise we would lose even the assurance that our essential workers will make it to their places of work.
Yeah.
Put that
Public
into the
transport is an
context.
event. Yes.
Put that in context of what has been proposed as a recovery fund. Let's say 330 up to 350. I think I've seen 380 billion pesos
Yes.
as a recovery fund. You're basically saying 10% of that can actually help to essentially
Yes.
subsidize our public transport system for 3 to 6 months.
Yes.
That seems to be a reasonable proposition.
Yes, for me, it is. It's not something that is nice to have. It's something that is absolutely essential. We need to look at it as a way of giving us stability at this time when so many things are being disrupted. At the minimum, we need to know that public transport services will be there running when we need it, even though uh, it will probably still be inadequate. So my sense is look at it as a way of maintaining an essential service in the same way that we need to maintain our health services, our education services. We need to maintain now our public transport services. In the past, purely on the private sector, right? If the jeepney operator didn't feel like running his jeepney that day, fine. If a bus operator said half his fleet would be out of service, then so be it. But now we can't allow that to happen. It's just too much of a risk to have, this additional crisis on top of what we already have. The
Sir,
other
the
thing I
other-
want to mention,
Go
sorry,
ahead.
maybe just to add, you see,
Yes.
going back to Ami's original question, we have to see this amount, this budget, let's say of 30 billion, as an investment in reform and an investment in transformation into a far better public transport system than what we have today. For decades, this type of reform has always been sidestepped by all our government officials. It was always in the too hard basket, right? Too much opposition, too much. But now, you see, we are in a golden moment where even public transport operators will say, yes, please give me a contract and I will run my bus. I will send my drivers out to drive this bus so many hours a day. Because if we go back to the normal, franchise and fare collection and fare box system, there is no certainty that they will make money, especially when only half their seats can be filled.
Well, you have another.
But sir, do you need a
Yes,
new legal
yes.
framework for all of these changes? Would you need a new legal framework for this?
Absolutely not. Actually, up to now, really what's in our law is a franchise is a privilege. People have franchises, at the discretion of the government. So we now have an opportunity to say, let's supplant this set of franchises and go into a different business model for delivering our public transport. And I have to commend the Department of Transportation. They have been working on this a long time, and they have been talking already about consolidation, about route rationalization. To their credit, just last week, LTFRB announced a rationalization of the bus routes. So we now have a new set of bus routes which make more sense than the many overlapping routes which we were used to for decades and decades. Now we have a new way of structuring how the different transport services will operate. We need to complement that with this approach to service contracting to make those routes run efficiently once we get back, after the quarantine. So again, a golden opportunity.
Well, you have another proposal that seems to be more feasible these days. We're seeing a lot more bicycles on the streets. And that's one of your proposals, to set up bike cycling stations. You think this can move forward, considering the pollution in Metro Manila in particular, considering that once vehicles are back, people might think twice about taking bicycles to work.
First, I want to thank you personally for what you wrote the other day. Just last week, you wrote about,
Biking.
the promise of biking. And I think that's really the message we have to give to everyone. First, again, I want to sound an alarm. And the alarm is this. Whatever we do now to make our public transport more efficient, even if we try to put the public transport on dedicated lanes to make the buses go faster, it will be inadequate for the demand that will be coming out. Millions of Filipinos will have no option but to walk or cycle. If we want to see fewer collisions, if we want to see fewer fatalities, we need to create safe walking and safe cycling corridors in every city. So this is a message to our LGU chiefs. please look at the possibility now of creating networks within your cities where people can have spacious walking, physically distanced, and where cyclists can bike safely. Already during the past 2 months, we have observed so many essential workers switching to bikes and using bikes for their everyday travel. This needs to happen in a big way, and we need to encourage more and more people to do that. The one good reason also for doing that, the more people shift into walking or cycling, it reduces the burden on our public transport system. So there will be less pressure to crowd, less
Right.
pressure to actually, you know, uh, have undisciplined queuing. So you also asked about pollution. Uh, there's actually a scientific uh, finding that people sitting inside cars take in more pollution than the cyclist going past on a bike lane. And this is something that I
Oh,
think that
really?
people need to think about.
Really?
Yes, you're actually breathing in more pollution in a car stuck in traffic rather than a cyclist that's whizzing by. And I think we've noticed, the past few days, the air has been much cleaner,
Yes.
and we can actually have uh, that that type of perhaps experience on a daily basis if we have more people shifting to public transport as well as walking and cycling. And this is, I would say, one of the things that the Department of Transportation is working very hard on. Uh, I I won't say anything about it, but uh, you know, uh, please expect some very welcome changes in terms of the environment for public transport, walking, and cycling in the coming weeks.
Okay.
This is something that will, I think, be welcomed by commuters, but it should also be welcomed by car users because the more people are able to shift to these other modes, it means also fewer people that will be in the same car lane stuck in traffic, right?
Right.
That's what we want. Fewer people
Okay.
in cars so that when you want to use your car, you'll be able to use it with less congestion.
All right. Time to stock up on sunblock.
Okay.
Sunblock. And a good helmet and lights. And
Vitamin
you
D
know,
is good against COVID.
yes. And the health benefits, I would say in the last few weeks, the biggest champion in this government for cycling, remarkably, has been the Department of Health. Please go and commend them about that because I've heard they have been mentioning this in their IATF meetings. And in the next few weeks, I'm hoping that IATF will come out with a very strong message to push for cycling, to push LGUs and national agencies to install those protected cycling networks. If that happens, we will have happier, healthier Filipinos with much better commutes. So I think that's, in a way, the silver lining that we should all look for in this crisis. If we come out of this with something better, that would be in the transportation and mobility area. And I'm praying that it will happen.
Yeah.
Great.
Okay.
Great.
Pero sir,
Oracle.
naintriga kami sa sinasabi niyo na in the next few weeks, something significant will happen that you cannot yet talk about, but maybe you can give us a clue.
Well, I think it's something that we see commonplace in many other cities, but really has been, so rare. And it has to do with prioritizing public transport, walking, and cycling on our roads. That has to be the number one principle today and the number one principle to make our cities more livable.
All right. Yeah.
Okay. Looking forward to it.
Ako, baka ibaba niyo mga kotse.
You know,
Kailangan tayo.
Magiging
Bukas
mura
puro
ng
mayor.
kotse. Magiging mura.
Joby, puro mayor ang guest bukas ha.
Yeah.
Puro mayor.
yeah, we are not against car ownership, but car use is what we have to temper. You know, countries
Yeah.
like
Yes, sir.
Japan, Korea, Germany, high incidence of car ownership, but every day they take public transport, they walk, and they cycle.
Okay.
Tsaka it's interesting when you said na 12% lang ng mga households sa Metro Manila lang may kotse, and
Yes,
yet we have all
you
this
see,
traffic. So
our
that's generated by
streets
only
are
12%
filled.
of the population in Metro Manila.
Exactly. Our streets are filled with cars, and so everyone thinks, maybe even MMDA thinks that their client is the car owner.
That's
No,
only 12%
sir.
pala of the-
Your client is the person without the car.
Yeah.
Please make the person without the car your client.
Okay.
All right.
Okay,
Yeah.
sir. Great insights from Mr. Robert Siy, advocate of sustainable mobility and member of the Move Us One Coalition. Sir, thank you for joining us tonight.
Maraming
Thank you,
salamat po.
Thank you very much.
Thank you.
Thank you.
Well, thank you, Paul. That's all for this edition of the Chiefs. We
Oy,
hope
happy
to discuss
second
here.
anniversary.
Ay, happy anniversary.
Kami na. Happy second anniversary.
2 years na pala tayo.
Ang the Chiefs.
Yeah.
Okay.
Yeah.
And to celebrate, I don't know,
Good news.
neutral news, pero may balita ang Philippine Star, Alexis Romero, para rin po sa lahat ng nanonood. Huwag po kayo magpuyat. Wala raw pong presidential speech tonight. Wala raw pong announcement tonight. That's according to the Philippine Star's Alexis Romero.
Kaya po kami umuwi ng maaga ngayon.
Nasa Davao pata si Pangulo.
Hindi kailangan
Siya umuwi ngayong gabi.
Huwag po kayo mag-overtime, kakaantay ng announcement today. It's a Monday, dapat sanay na tayo. Wala pong announcement today on a Monday.
Okay.
Okay, that's it. We hope what was discussed here will keep the conversation going. I'm Edwin Gao, One News.
I'm Ami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay. We are One News.